The Weekly, hosted by the editors of Pro Builder and Pro Remodeler, starts now.
As we all know, homebuyer demand has only grown during the pandemic. Buyers want more space for working, learning, relaxing in their homes, but they're also becoming more health conscious as well for obvious reasons. The National Kitchen and Bath Association reported in its second quarter report that 98% of industry professionals are seeing more demand for wellness products. A large chunk of that demand is for air purifiers, touchless faucets, and antimicrobial door handles, the study says. Home builders have already noticed the trend and have changed accordingly. Arizona-based home builder Taylor Morrison began offering healthy home features in its new builds at no cost to the buyer this July. The builder found that more than 1/3 of home shoppers wanted a new home rather than an existing one due to a new home's health and wellness features. Their package includes a whole house air filtration system, smart thermostats, bath fans with antibacterial technology, water filtration systems, safer paints, and touchless faucets. MI Homes in Ohio already added Vital VO technology to its new homes as well. And so specifically, this is a fan that features germ-killing lights that can clean the air as it moves around. But one builder, CC Homes in Florida, has taken it a step further and added touchscreen on-demand healthcare services to its residents. With this digital health kit, residents can remain safe in their homes and still get their temperature taken, along with heart, lung, eye, and ear monitoring. Let's see what their CEO has to say about it. So I'm here with Jim Carr, CEO of CC Homes, a builder developer located in Florida. His company began offering digital health monitoring kits to its master plan communities late last year and this summer. The kits are powered by TytoCare and allow users to monitor their health via touchscreen, camera, and microphone. The kit has adapters used to record ears, the throat, heart, lungs, and can take a user's temperature. So thank you and welcome, Jim. I understand CC Homes is one of the largest builder developers in Florida. And so I was just hoping if you could briefly explain for those watching and listening a bit about the types of communities your company does and your target market.
Sure. We're located in South Florida, Miami to Palm Beach, and over to Collier County, which is the greater Naples area. Build large communities, project from very small one at 25 homes to our largest, which is probably 3,000 homes. And we build about 500 homes a year.
Could you tell me, why did CC Homes decide to go toward the health monitoring technology route?
With my interest in healthcare and equal interest on what we can do different in our homes, especially around technology, I knew of these kits. I knew of the care on demand, digital healthcare Baptist Health is offering, and really wanted to be the first builder to offer it to the public. I really see healthcare flowing to something like care on demand, a digital where you can call up your doctor, have a chat just as we're having now, and it's a visit with a primary care physician. We're a consumer-driven society. We want convenience. It could be Amazon, Instacart, or healthcare. So the idea of having to call, make an appointment, wait in a waiting room, especially pediatrics with children, with other sick kids in the waiting room, telemedicine is the future. We saw that, and we thought we could offer something different in the homes. So we started doing it in one of our communities pre-pandemic. Pandemic came along, and telemedicine has been huge as far as a screening and primary care vehicle, for sick people. And we decided to do it company-wide, and it's been very, very successful. We've gotten a lot of recognition, and actually I hear other builders are starting to do the same, and I encourage it. It's a great program for home buyers. I mean, it's cheap, it's efficient, it's convenient, and the idea of being able to get a primary care physician, on your iPhone and a matter of a minute or so. It's just fabulous. It's the
Mhm.
future. Better health care, better for the for the consumer, a lot cheaper, and cost is very important. So this is part of that change in national healthcare. I think we're gonna see. Obviously, we've got a lot of publicity, a lot of recognition. Our customers really like it. It's helped us sell homes, but you know, it's good for people.
When you say cheap, are you saying from the builder developer standpoint or the resident standpoint or both?
Okay, so we're paying an annual fee. I probably shouldn't divulge it, but it's small. So the first year, the family can has unlimited access to docks. We're providing that along with the actual equipment. We want to encourage people to use it. Uh, One of the things that is starting to happen is insurance providers are recognizing telemedicine, and some are already including it in plans. I think it's a pretty safe assumption that very shortly all insurers will recognize it. And the idea again for homeowners and apartment renters is being able to have cheap, efficient health care online. And again, what's really going to make it work on a national basis is the insurance companies accepting it.
Oh, do you predict a growing interest in these digital health kits when it comes to builders providing them in the homes?
I hope so. Um, I understand that several other builders are, negotiating, a deal identical to ours. And again, it's great for the public. Listen, I'd love to see every builder nationally do it. I mean, healthcare is a real problem in this country, but we'll see where it goes. I think definitely uh, telemedicine is the future.
And would you say that, builders would be doing a disservice to themselves if they didn't start offering some type of healthy home feature in their new builds right now?
Yeah, I think so. I think we have the same obligation. Um, Environmentally friendly homes. Listen, I started building back, I hate to admit it, 76. And, I remember back then, we didn't have energy efficiency. In Florida, homes were built back then without air conditioning, without insulation, rather. So, where we've all accepted the social responsibility of energy efficiency, environmental sensitivities, et cetera, again, we have a healthcare crisis in the country, and I'd like to see all of us say, hey, if we can help solve the problems, provide healthcare to all, provide efficient healthcare, you know, uh, I hope all of us do it.
Do you think offering these digital health kits is now drawing interest from more people to want to live in your homes?
I think so. I think, I describe it as a tool bag. Um, we build mostly single family, some townhouses. Uh, there is the shift in lifestyle, well documented post pandemic. Our sales are booming at the moment. I mean, you know, because of switches in lifestyle, people coming from more urban areas into the more suburban. The people leaving the high risk areas. New York being an example. Um, People are very, very sensitive nationally, you know, about health and safety. And again, I would describe this as just another little thing in our tool bag. I mean, we're designing amenity centers with safety in mind. Distancing. There we are doing air filtration, safe gyms, stuff like that. We've gone into age-restricted rentals. The biggest thing being a safe environment for the over 55. And again, as I said a minute ago, this is just another thing in the tool bag. And I think you would agree. we're all very, very concerned about our health and safety today. The past 6 months has been very sobering for this country, very tragic in many ways.
I was wondering if you had any advice or tips for builders who may be considering adding a digital health kit like you do in their own builds.
Yeah, I think my advice is the equipment is easy. Align yourself with a great healthcare organization, which can actually provide the medical care. And I would tell you do it with a system, you know, which can handle the very minor illnesses and the more acute. And I see this is a gatekeeper function. Example, your child has a sore throat. You talk to the pediatrician online, you get a Z-Pack, that's it. But if it's more acute, you want the doctor to be able to refer to a specialist, refer to urgent care, or if it's super acute, go to the ER. So, I think my advice is pick the right partner so you can really provide quality health care.